Emotional and psychological impact of illness on patients and families. When dealing with illness, individuals face a multitude of additional challenges that accompany the actual experience of pain. Families or caregivers involved in the management of the chronic illness of a patient are forced to adapt to the changes, which often causes disagreement, conflict, and failure to cope with imposed stress. Therefore, it is imperative for a medical social worker to identify the negative implications of illness for families and patients and implement psychological coping strategies. The use of coping strategies for managing illness-induced stressors is an effective method of ensuring a comfortable family life with a person with the illness and the beneficial patient health outcomes in a long-term perspective. There are many psychological factors that have a negative influence on the well-being of patients and their families. According to Chiang, one of the most influential psychological factors associated with chronic illness is the high level of stress. Indeed, exposure to stress is positively correlated with the risk of mortality, which is why it is imperative to reduce stress for patients and their families. Another psychological factor associated with chronic illness is social isolation. In particular, when a person has a disability and his family provides care on a daily basis, the patient and the family might experience diminished interactions with others, further hindering recovery. It is a significant consideration since research holds that social isolation and loneliness can have profoundly detrimental effects on mental and physical health. Lastly, the feeling of guilt is a psychological factor that imposes difficulties on family communication when dealing with an illness. Indeed, a person with an illness might feel down with guilt that they caused problems for the family, thus creating a negative environment in the family. In light of the identified psychological factors, the patients and families experience the difficulty of facing the reality of the illness and finding inner strengths and motivation for dealing with the complications. The communication in the family might worsen due to stressors and possible disagreements. Moreover, the difficulty of taking care of an ill person might impose restrictions on personal life, which ultimately causes emotional distress in both the patient and family members. Overall, illness becomes a central problem in the family, the management of which defines the overall life of all its members. One of the factors that a medical social worker might find challenging to approach is social isolation. In particular, a person experiencing illness might be close from society, as well as the caregivers might be busy with caring for the patient, neglecting their social life. However, it is essential to ensure that both family members and the patient obtain adequate guidance on how to maintain a healthy emotional and social lifestyle while managing an illness. To resolve the issue with the social isolation associated with illness, a medical social worker should use an evidence-based strategy for the family. According to Martiri and Schultz, the involvement of family members in the experiences of the patient with a chronic illness helps overcome physical and emotional problems and healing. In particular, a medical social worker might use such strategic interventions as patient education, support groups, and cognitive behavioral therapies to incorporate both families' and patients' efforts in coping with illness. In such a manner, the families will be informed and supported by healthcare providers, and patients will have understanding support from their families. In summary, it is essential to address not only the physical manifestations of illness experienced by the patient but also apply broader thinking about patients and their environment. In particular, the evidence presented in this paper shows that emotional factors associated with illness significantly impede the wellness of the patient and their family. It is through the use of specific coping strategies that a medical social worker can ensure that the patient and their family have the necessary means to manage the illness.